So, welcome to Reconnection, the podcast that connects rare disease patients and educates medical professionals and the public and raises awareness for the 95% of rare conditions that currently lack FDA-approved treatments. I'm your host, Joanna, and today's episode is one of incredible perseverance, devastating odds, and most importantly, hope. I'm honored to welcome Paul, the president of Cure CLCN6, and the father of Paxton, a brave young boy diagnosed with an ultra-rare genetic disorder caused by a mutation in the CLCN6 gene. Paxton's condition impacts nearly every part of his life, causing severe epilepsy, autism, developmental delays, and hypotonia. This mutation was only recently discovered and is so rare that initially his doctors could offer no treatment and little hope. But Paul and his family refused to accept that answer. Through tireless research and incredible determination, they connected with the I'm not sure if I'm pronouncing this right, Hooray Gene Therapy Center in UMass Chan Medical School, where scientists are now offering a pathway toward potential life-saving gene therapy. But the pathway comes with a daunting price, a tag of $1.5 million. In this episode, we'll hear about Paxton's journey, the hurdles his family faces, and how they are fighting not only for their son's future, but for all families impacted by the CLCN6 disorder. As always, please remember this podcast is for educational purposes only and not to substitute medical advice. Please consult a qualified healthcare provider before following anything in this podcast. Also, please keep the comments respectful and keep politics out of the comments. Let's see. What were the first signs something might be different?
Was originally diagnosed with autism, and when he turned 1 year old, he took a screening, or I took a pediatrician screening, and they were looking for signs for autism, and he kind of failed the screening. They said he didn't meet any of the developmental milestones that they were looking for. So he started early intervention services, and over the course of the next few years, 1, 2, 3, 4 years old, he always made very minimal progress. All of his challenges, though, were just chalked up to being autistic. When I say challenges, I'm talking about like intellectual challenges. Fine motor skills were very behind. Gross motor skills were very behind. He didn't walk until he was about 16 months. His speech, he was nonverbal, but he had some words that he could try to say, but they were more approximations. And he ended up getting diagnosed with apraxia of speech. Well, when he turned 5 years old, he began having seizures. So Paxton had already undergone like microarray panels looking for genetic markers that might explain autism, intellectual disabilities, and nothing came up. When he began having seizures, they did more DNA testing looking for markers that might explain epilepsy. Nothing came up. So again, just kind of chalked up to the autistic experience. Like, well, he's autistic and he happens to have epilepsy as well. After a year of being on medications to try to control the seizures, we could not get full seizure control. So an epileptologist ordered whole exome sequencing. And that is when they found that he actually has a mutation on the CLCN6 gene. So a lot of his challenges presented as autism, epilepsy, and apraxia, of speech.
So what was the process of like going from initial mutation, initial autism suspicion, to discovering the CLCN6 mutation?
When you have a child with special needs, comparison's the thief of joy, but I think it's only natural to compare ourselves and compare our children to other children. And there's this grief process that happens when your child isn't able to do things that other kids are. Your child doesn't interact with other people the way that other kids do. And you grieve that because that's not what you imagined for your child when they were born. But you love them just the same, and you'll do anything to protect them. And when we ended up getting the diagnosis that he has a mutation on the CLCN6 gene, I'll never forget this phone call with the genetics counselor, and it's giving me anxiety again just thinking about it. So they told me that Paxton has this very rare mutation. It has only recently been discovered by researchers, so not a lot of information was known about it. But the only thing they do know is that it's neurodegenerative. And I asked, okay, so what do we do? And they said, well, there's no treatment and there's no cure. And so from that moment on, your brain just goes to he's going to die. Like this is just going to get worse and worse because when you go home and you start googling the gene and the symptoms, the research paper that was available at the time, well, that was written by the researchers at the Max Delbruck Center for Molecular Medicine in Germany, was very grim. Some of the children had already passed away. So now you find yourself in that bargaining part of grief where you're like, why couldn't it just be autism and epilepsy? Why does it have to be like a genetic mutation? Like you would give anything for it just to be autism and epilepsy and not a neurodegenerative mutation.
So, addressing the audience here, I did want to say hi. So just but do notice that I am getting some of those comments on it. I'm trying to stay on camera, and so and let's see. How did it feel to finally get a diagnosis after years of uncertainty? And what did the doctors tell you about what to expect?
There's a lot of denial. We like to think we're pretty logical, rational people, but your brain does go to maybe there was a mistake. Should we get him tested again? This can't. Maybe they just made a mistake, in the paper. He's not presenting as severely as they are. Maybe it is just autism and epilepsy. Um, but that's just part of the grief process. It's not healthy. It and it's not right. It's like they didn't make a mistake. He does have it. So working towards the acceptance that he does have the mutation. So once uh, once we were able to accept the fact that he has the mutation, we realized that while there's currently no treatment and no cure available, and that's what the genetics counselor told us, there's no current treatment, no cure. We learned through our conversations with family members and things that we were like reading through news articles is that the ability to develop treatments and one day even develop cures for these genetic mutations is possible. But the challenge that we were faced with is a challenge that many families like us are faced with, where your children have a disease that's so rare that it's underrepresented in the medical field. It's not studied because there's only so much money available to study these conditions. So there's like this utilitarianism approach where researchers tend to focus on the diseases that are going to reach the most people, that is going to have like the most impact. Like there are gene therapies that are being developed for a variety of genetic conditions. I want to say somewhere around 2000, but just some of the more common ones that your audience may know: Duchenne's muscular dystrophy, Rett syndrome, I think cystic fibrosis, Dravet syndrome, which causes severe epilepsy. All of these have some gene therapies that are being developed. But when it comes to these orphan diseases, The parents, like me and my wife, we have to drive the research. We have to find the researchers. We have to coordinate the scientists. And we're, I guess, kind of worst of all, or the most challenging part that we're finding right now is we have to pay for it. We have to fund the entire process. And this particular project is going to cost $1.5 million. So, how did we feel when we officially got the diagnosis? Well, we're devastated because instead of mourning a child's like life that we had envisioned for him, we're just mourning the possibility that he may pass away before reaching adulthood. Um, but we also were able to take that grief and anxiety and spring to action because we knew that something can be done, but we were going to have to work very tirelessly and be relentless in finding researchers who are willing to work with us who can develop a treatment for this condition.
Yeah, 95% of rare conditions don't have an FDA approved treatment, which is kind of scary. But happy to have and that does have one. um, so I'm one of the 5%. Uh, see, what are Paxton's biggest uh, what are Paxton's biggest day-to-day challenges, both medically and in his quality of life?
Since we've received the diagnosis and he's been on different, anti-seizure medications and they've had different side effects. So as of today, we don't know if some of his biggest challenges are related to medication side effects or if it's progression of the disease and that there's neurodegeneration that is occurring. But his biggest challenges right now is that he's not mobile. He can walk if you stand behind him and give him trunk support. He can walk if he has like a gait trainer, which we're hopefully going to be getting within like the next 2 months because referrals have been put in. So his legs work fine right now, but it's the balance and stability that he doesn't have. So he's not able to get up off the couch like on his own right now, where he used to be able to. Even back in like December 2023, like a month before we got the diagnosis, when we were on like a little bit different medications, he was up walking around the house. He was going to the pantry trying to like get his own snacks. He can't do that anymore. Other challenges are he's losing some speech. He used to have a lot more kind of couple words, like, and I say couple words, like he could pair a couple words together, and you would know like what he was asking for. But he's losing a lot of his speech, so he does have an AAC that he has to to use to communicate. But the communication is becoming more challenging for him, and that must be incredibly frustrating for him because he used to be able to use some kind of language to communicate it and now he can't. um his quality of life is also really impacted because he's very sensitive to these medications where they make him very tired. He's at summer school right now and he's been able to stay awake, but last school year he slept almost every day at school for a little bit in the mornings. Sometimes I'd drop him off at 8:30 and he would sleep until like 11:30. Sometimes he might sleep until 10 o'clock, like he would fall asleep. And the seizures themselves, despite the medications, despite having vagus nerve stimulator surgery, he still has seizures every night when he's sleeping, sometimes when he's awake. But when he's sleeping, he is ensured that he is going to have at least one seizure, if not more. So that's where we're seeing the biggest impact on his quality of life. Medication side effects make him very drowsy, really sedate him, impacting his motor planning, motor control, affecting his speech, his ability to even be independent with walking around and being mobile, and making him incredibly lethargic. They're finding, and so I can speak a little bit about Paxton, but I'll throw in some anecdotes as well. So since forming Cure CLCN6, we are the only patient advocacy group in the world that I know of, which is kind of why we formed it, because nothing existed, and we wanted to make something happen with treating this disease. Grateful for that. One of the things is that there are some similarities with these children. Why this mutation is causing developmental delays is causing, autism, is causing intellectual challenges. I don't know kind of what the mechanisms are of why this mutation is causing that challenge for children, but it is. All of the children that we have been in contact with have been diagnosed with, I think all of them. I might be misspeaking, and if that family is watching, I do apologize. Almost every family, the child has been diagnosed with autism spectrum disorder. Every child is well behind where they should be developmentally, so they're exhibiting global developmental delays. Why that's happening, I don't know. With the seizures, though, I can also tell you that with this gene, there are different proteins that can have the mutation. And that is why we're also seeing a different, what they call phenotype, which is the presentation. The children in the literature, their proteins that were mutated is not the same as Paxton's. It's not the same as these other children that we're finding as well. So while there are some similarities in how they present, specifically epilepsy, autism spectrum disorder, developmental delays, you do see a wide range in the phenotype of how they present. So that is to kind of summarize his the development piece. He has autism. He does have global developmental delays. This is a common thing amongst these other children, and it is causing severe epilepsy as well. All these children also have impaired motor planning, gross motor skills, fine motor skills, and even like the apraxia of speech is very common amongst all of them.
You do know a few others.
Mm.
So even though they might not be local, but if you do hold the events, they a lot of times will come.
We're in the United States. There's only one other family in the United States, but they're kind of on the other side of the country. There's a couple families in Mexico. There's a family in Canada that has just reached out to us, Ireland and Scotland. So in terms of us hosting events, I think it's going to be incredibly difficult for them to make it anything that we would be holding locally.
Sometimes you'd be people.
Also have strong reason to believe that there are more families out there that we have not found, or they have not found us, and that there's more children out there that are underdiagnosed, like Paxton, like they're just being chalked up to being autistic and having epilepsy, or they're being misdiagnosed with other conditions because, and the whole exome sequencing is not being offered to them for whatever reason.
Because I imagine it's probably a pretty expensive testing.
California, and Paxton does qualify as having a disability. He qualified even before the mutation. So Medicaid was able to cover all of it, because I think it would have been probably pretty cost prohibitive. It's something we have been able to pursue. But fortunately, it has been covered by his insurance.
You built you built an incredible advocacy organization, Cure CLCN6. What drove you to start this effort?
The diagnosis back in January 2024, and had some conversations with some family members and some people in the field, and we recognized that cell and gene therapy is a thing now, where we're kind of like at the dawn of this new era of medicine, if you will. We're still in the very early stages, but we do have the technology and the ability to develop treatments, and one day even develop cures. So I knew I wanted to do something, but I didn't know what to do, because there's nowhere to go for this information. Genetics counselors didn't give me any resources of like, hey, why don't you should try connecting with these university medical centers that specialize in research and see if they'd be willing to study Paxton. They just told us that we'll learn more about this mutation by observing Paxton. So when you go home and you start just Googling information, you don't really know like what keywords to put in. So I knew I wanted to do something. So I formed Cure CLCN6 as a nonprofit entity registered in the state of California. And I didn't really know where to go from there or what to do. So I was just reaching out to different researchers like at the NIH, and it was not something that they would be able to take on. And also they were just more like academic, kind of based research. It wasn't until I was just Googling like gene therapy, I was just constantly looking at like gene therapy news, gene editing news. And I saw an article about a family in Oregon. Uh, Tommy Pham is the dad's name, and he started an organization called the Radon Science Foundation. His son has a very rare disease as well. And the Pham family is working with University of Massachusetts Chan Medical School to develop a gene therapy for the mutation that his son has, his son Radon has. And I thought, like, I want that. Like, I want that for Paxton. And so I had reached out to Tommy, and then then I had reached out to UMass, and Dr. Miguel Sena Estevez, who is the director of the Jorge Gene Therapy Center at UMass Chan Medical School, responded right away with like, let's set up a meeting. Let's see what we can do. So they hold like that initial meeting, and they kind of look at the mutation, and they have to make a decision of, do they think this is something that they can develop a treatment for? And fortunately, were. So what drove me to start this effort was the knowledge that something can be done for my son. And I was aware that it was going to cost us an incredible amount of money. But as I had said earlier in the interview, you love your child just the same, no matter if they're neurotypical, whether they're neurodiverse, whether they're disabled, whether they're able bodied, doesn't matter. You will do anything you can for your child. So that is what drove me to start. Be the initial recipient of this gene therapy. As we're finding other families, I feel a real responsibility to get this done for them as well, for the families that are already out there that we know of, for the ones that haven't been diagnosed yet, the ones we haven't found, and for the children that are still to be born. Um, I'm in a position, my wife and I, where we can do something. We can lead this research. It's incredibly difficult. At times, we question if we're going to be able to get there or not, but we feel a responsibility not only for our son, but for these other children, these other families that we're finding to make this happen. Developed at UMass Chan is going to use a silence and replace approach. So Dr. Miguel Sanesteva said that a cure for this condition would be to do gene editing, which is where they would correct the mutation at the base level, meaning they would swap out the incorrect protein with a correct protein. It's in, it's incredibly like complex. I don't quite know the inner workings of how that's possible, but it is possible using the CRISPR technology. But Dr. Sanesteva said that approach is not safe enough yet for use in humans because the accuracy, meaning the insurance that there's not going to be off target edits, is not high enough yet. And it could cause a slew of other problems if there are off target edits. So, what he proposed instead was to silence the toxic protein that Paxton's body is producing and provide a functioning copy. So, it gives a lot of hope because this this approach would work on children whether they have the same mutation as Paxton or whether they have a different mutation as well. It's going to be effective on children with any mutation on the CLCN6 gene. And they call those kind of different mutations gain of function, where the protein is producing like a toxic protein. The cell is producing a toxic protein, or loss of function. The cell is not functioning properly. Well, in Paxton's case, he has that what they suspect is a combination of a gain of function and loss of function. So that's why this is going to be a silence and replace approach. But it gives hope because it is going to be helpful for other children. Now, there's obviously some additional caveats that go into that, such as the progression of the disease or the age of the children. and accessibility will become an issue. But at least parents today who are aware of our organization, or maybe they're just getting that diagnosis today, or maybe they're just going to find us today, they can at least sit there and know that there is an organization out there, there is scientists out there who are actively developing a treatment for this mutation that their children will likely be able to benefit from. And I do have to use like those caveat words because there's a lot of different variables that can go into it. But generally speaking, this should help other children. One last thing about what gives that hope. There is a newer capsid that has been developed by a researcher, Dr. Ben Deverman at the Broad Institute in Boston. This newer capsid can much more effectively cross the blood-brain barrier. A lot of the challenges with delivering gene therapies and really delivering any therapeutics in the brain is the blood-brain barrier, which exists to protect us from pathogens and viruses getting into our brains. But it also makes it, as of this point, incredibly difficult to treat diseases of the brain, Alzheimer's, dementia, various brain tumors. Well, these newer capsids are able to cross the blood-brain barrier because they use the capillary system, which is administered via a general IV, as opposed to having injected into the spine and traveling up the spinal column and into the brain that way. What that means for Paxton, what that means for gene therapy, what that means for just potentially medicine as a whole is many, many, many more cells can be accessed using this method. So we're potentially talking about the ability to give patients like Paxton transformational change, not only life-saving medicine, but like a transformational treatment, which would obviously greatly impact his quality of life and the quality of life of his caregivers.
And how they're helping rare disease families.
I have is UMass. So UMass Chan Medical School, the Jorge Gene Therapy Center, I don't want to say they're one of the only ones, but they're one of the only ones that responded to us when we had reaching out for help to try and find someone who might be willing to work on developing a treatment for this mutation. They work with about 40 other families right now, just like us. They're just everyday families who have a child with these orphan diseases, these ultra rare diseases, and we're the ones that have to lead the research on it. And we're the ones that have to raise the money for it. And most of these gene therapies cost well over $1 million. I can only kind of speak about the price tag of what ours is. I can't speak about the price tag of others. But I think UMass is giving hope. They are giving hope to families like us because when you receive this diagnosis, I think outside of losing a child, it's probably one of the worst feelings that I think a person could have. Or maybe I shouldn't say. I should only speak for myself. It's the worst that I have ever felt in my life, and I think the only thing that might eclipse that would be the death of a child. But when you are faced with that very real prospect, and you are also told there's no treatment, there's no cure, that you're just going to have to sit here and watch your child deteriorate until they pass away. It's as devastating as it sounds. So UMass, through their technology, through their researchers, and through their willingness to work with these other families, gives hope. And that hope that keeps us going, that gets us out of the bed in the morning, that keeps us pushing into fighting. That every day we are actively trying to raise awareness and raise money so that we can make this gene therapy happen for our son and to pave the way for the other children that we are finding and that we are yet to find.
So the fundraising goal of $1.5 million is both inspiring and overwhelming. How are you approaching the challenge of, and how can others help?
Great question, because as I kind of said, when you get this diagnosis, there's nothing you can do. It's like, put me at the base of the mountain, we'll figure out how to climb it. Well, climbing it is a lot harder than I had anticipated. And I remember back to my initial email that I had with Tommy Pham with the Raiden Science Foundation. Before I even connected with UMass, I just kind of saw his article, and I shot him an email and introduced myself. And he did tell me that he thinks fundraising was like the hardest part of all this. And I kind of thought, if you just find the researchers, that felt like the hard part. That are promoting our local fundraisers, whether they're community events or they're restaurant fundraisers. We have some success with them, but the challenge is letting our community know. We live in a community of 113,000 people, and the two towns next to us also have over 100,000 people. Pretty heavily populated, this part of Southern California. So there's a lot of people who could potentially come help with these events, and by come help, it's like, could attend your events. But the messaging is the hardest part. It's the absolutely hardest part. Um, I ran into another parent that was in class with Paxton a year ago, so she understands what's going on with them. And she's like, I didn't even like hear about like these events that you're doing. Like, we're doing a clothing drive. And I remember talking to her. I'm like, yeah, I was like, we're really finding, outside of promoting our events on like Facebook, Nextdoor app, or putting in like a local like newspaper, we don't know how to reach people. So that is one of the biggest like challenges. What we are finding that works really well is, since we are a 501(c)(3) charity, we are able to attend community events and get a nonprofit booth to promote our organization and solicit donations. We were at a local event this past weekend. It was a 3-day event, and people come from all over California, and some people traveled from out of state as well. We had people coming like from Arizona and Texas. What my wife and I found to be very effective was just asking people if they'd be willing to make a small dollar donation. People would walk by and say, fundraise, be like, hi, I'd be like, I'm fundraising for my son. He has a rare disease, and we're working with University of Massachusetts Sham Medical School to build a gene therapy. So we're here today to ask if people are able and willing to make small dollar donations, because every dollar helps. That approach like absolutely blew us away. Normally, when we would be at events, it was a little more wordy. It wasn't as concise. We would tell people how much we had to raise. We would ask for a donation. Maybe like 10% of people would donate. Asking just for small dollar donations using that quick hook and approach, I think the conversion rate was 70 to 80%. So that was hugely successful. We actually received about $1,700 in small dollar donations at this event. So what that tells us is that we think we have a good hook. We think we have a good approach. Where we're going to run into some problems is, there's a lot of money that has to be raised in a little bit of time. And how do we scale something like that up? How do we? We're a husband and wife, and we have our kids have special needs. How do we get at as many events as we can? So that would have to be scaled up. Another way people could help potentially with these events would be hosting tables for us, under our 501(c)(3) umbrella. This is just kind of a general thing. I haven't really ironed out how it could work, but these are things I think about. How could people help? Well, making a monetary donation is probably the most direct and effective way. But if there was other ways people wanted to help, we could talk about, in their community, hosting like profit sharing at restaurant fundraisers, because that marketing, it's that communication, it's getting people in. We are a 501(c)(3) organization, so we would be eligible to participate in these events. That would be one way to help. Being a host, recruiting people to attend these restaurant events. So people go out, they eat some pizza, they order burritos, get some chicken wings, whatever the restaurant is, and we get a little bit of the proceeds. So people go out, they're going to go out and eat anyway. Helps us out as well. Or hosting events, or at I'm sorry, not hosting events, hosting tents at community events, street festivals. We could pay for the fee, and if people are willing to go out and help to collect the money for us, that would be a huge help, because it's going to give us reach into different communities. And me and my wife are only two people, and we can only do one event at a time. I'm sorry? I do not, but it's one of the many things that I would like to do.
Could be a way to get donations.
We just have like our Facebook, page. Cure CLCN6 is the official, and Paxton's Pioneers, which we originally created back in September when we were starting this journey.
So, what would it mean for you and your family to reach this goal and begin the gene therapy process?
We love our son and our daughter, because we have a 5-year-old daughter. We love our children so much, and every day that reality is there, like, we're observing everything Paxton does, and it's like, is this regression? Is this neurodegeneration? Is it medication side effects? Um, every day we're just constantly, worried about losing him. And the funny thing with this gene therapy is, in a, he'll be the patient. Paxton will be the patient in the clinical trial in about 2027. So we're about 2 years away. It feels like it may as well be light years away in terms of getting him an effective treatment. But also, you have to raise the money, and it's like, raising that amount of money in 2 years, and we have to make another payment next June. Doesn't feel like enough time. So it's kind of that contradictory kind of feelings, where it's like, we can't get this gene therapy soon enough, but also it's like, we don't have enough. We need more time to raise the money, because it's ultimately just like the two of us who have to like spearhead this. But it would mean everything to us. Like, I fantasize about this all the time. I fantasize about going to University of Massachusetts in Worcester, and I'm from Albany, New York. My wife and I lived in Massachusetts for a year. Um, I've been to Worcester. I may even have been to that campus, before. I've been to one of the UMass hospitals out there before, when I was working. So I fantasize about it all the time. I used to kind of fantasize about Paxton being able to do things that he's never been able to do before. But you know what? That doesn't matter anymore. It's like, I just want him to be able to live a long, happy, healthy life. And it's like, if he's going to still be just like cognitively at like a child level, or just enjoy doing kind of like much more like younger kid things like all his life, you know what? That is a-okay. We'll do it with him. We'll do whatever he wants to do, whatever brings him joy, whatever brings him happiness in his life. We just want him to have a long, happy, healthy life. And getting this gene therapy would go a long way with giving him a chance at that. January 2024, we just didn't know which direction to go in. We connected with University of Massachusetts in April, May of last year. Started having some of the preliminary meetings. We also connected with the researchers at the Max Delbruck Center in Berlin, Germany, because they are the researchers who found the mutation on this gene. They wrote the literature back in 2020. They actually participated in some of the planning meetings to kind develop like a proof of concept. We were able to get funding to do the mouse model through the Jackson Laboratory with a grant money through the NIH. I was just listening to a podcast last year and just heard it on a whim, and I just reached out to them because they were accepting applications for like these orphan diseases, and so it kind of converged at the same time. It's like got this phone call with UMass, got this phone call with Jackson Laboratory, and I put in the entry, and it was accepted that they would do a mouse model to study the variant, and brought them together. We think things are moving in the right direction. Just got an email this morning actually from the Jackson Laboratory, just saying that they're successfully still breeding the litters. They've completed the germline transmission. A lot of the science goes over my head, so I have to run that by some people in the know so they can kind of break it down for me, what it really means. But we've been fighting for this. January 2024 is when it started, but when did it become a reality that like we are committing to developing a gene therapy at UMass for CLCN6 mutations? That was last summer. That was probably about a year ago. May have been a little more into July than June, but we were having preliminary conversations and talks at this time last year. And we learned that piece about this newer capsid, which can access many, many more cells in December of 2024. So we're very optimistic, but we're also very scared at it still being 2 years away, having to, get the money to make it happen. What kind of neurodegeneration might happen to Paxton in between, like now and then. But we hold on to that hope because that's what keeps us going every day. Yeah, he gets speech therapy in a clinic through his insurance. We have in-home speech therapy because she kind of specializes in apraxia of speech. He also does get speech therapy at school, but as I mentioned, he's losing words. It's really scary to see, actually.
Line on the therapy on the that you have for getting this money?
We've raised about $100,000 as of today. We sent over a $40,000 payment in January. To UMass. They've only spent about 9,000. They're working on like designing the vector at this point. They're honestly doing a lot of things that are kind of going over my head, but unfortunately, we have some family friends who work in the field who can explain it to us. So the deadline, we're trying to break it down into smaller goals. We have to make a $155,000 payment next June, but I think the rest of the money is due shortly after it. So we're just focusing on one payment at a time. That $100,000 I said we raised, though, that's includes the 40,000 that we already sent over. So we still have to raise about $95,000 for that for a year from now. Yeah. Uh-huh.
Families who might feel alone or helpless in their search for answers.
Hopeless and alone throughout times, that I'd want them to know that grief never goes away. It's going to be what they call a constant companion now. But that grief can also motivate you and drive you. And I would tell you that if there is an organization that is already developing treatments for the same mutation or same disease that your child has or that you have, I would connect with them, because it's going to be a lot easier to fundraise as a group of individuals to get to these goals. Now, if you were in a position like myself or like the family in Oregon, where you're kind of it, I am happy to kind of give some advice about some things that have worked, that have not worked, I also would tell you that you're just going to learn as you go. So just start moving, because if you try to wait for the perfect plan, it's not going to happen. Things are not going to go how you expect them to go or how you envision in your head. So the important thing is that you just start moving. I would also tell them that the rare disease community is one of the most accepting and embracing communities I have ever been a part of. Every person that I have interacted with on this journey has done so out of the kindness of their hearts, expecting absolutely nothing in return. And I mean this from other rare disease parents, from people with organizations. I had a conversation with a woman because I'd reached out to the Muscular Dystrophy Association because they had some grant money for neuromuscular conditions, and I thought maybe we'd be eligible. We're not, but they said, you know what? One of our VPs, Angela Leck, should be happy to talk to you. She did a Zoom call with me, and she's the one who has got me in touch with the Broad Institute to get more information on this newer capsid. She was trying to connect me with another parent who had gotten some funding through California's Institute for Regenerative Medicine. So my advice is just start reaching out to people, because the rare disease community is incredibly embracing and accepting, no matter where you are in the world, no matter what your background is, no matter where you come from, because we understand that we are all human, that we all love our children more than anything in the world, and we'll do anything to help them. So just start going. Just start going and reach out for help. Reach out for help to me, reach out for help to other people in the rare disease community if you need it. So I think one of the most successful things was creating a nonprofit, creating a 501(c)(3). That may not be required for other people. And that's why my kind of advice to other rare disease parents is, if there's already organizations out there that are established, that are working with scientists, that are trying to develop treatments, gene therapies, connect with them, because you could probably start fundraising under their umbrella. Uh, I think the best example of that I can give is I believe it's the SPG50 mutation. So that gene therapy has already been developed. Terry Piravalakis, very nice man who spoke to me a couple weeks ago. He was in a situation I was in years ago with his son, Michael. He was living in Toronto at the time. His son had a very rare disease. He had to raise the money. So he did it. He raised the money and he created this Alpita Therapeutics now, and I think he lives in Encino, California. Now there are other families that are getting diagnosed with these SPG50 mutations. So Terry already laid the groundwork. So these other families that are coming along, they don't have to start from the ground up like I am, or Terry did, or Tommy Pham with Radiant Science Foundation does. They still have to raise the money for the clinical trial, which can be extremely high, but they're able to operate under like another 501(c)(3) umbrella. So what worked for us is creating a 501(c)(3) organization, because nothing existed. Cure CLCN6, got our hats. This allows us to do those profit sharings with restaurants. This allows us to get those vendor booths at street festivals, so that we can go out, raise awareness, and really just ask for donations directly from people. It gets us in front of people so that we can tell our story and solicit donations. Media coverage is helpful, but not as helpful as you think. It's going to drive some donations, but not as much as you think. You really have to get yourself in a position where you can just get in front of people and ask them for money. As hard as that is, I have like rejection sensitivity. I'm a very kind of like shy person, but when I say you'll do anything for your child, you'd be amazed at how you'll put yourself out there.
Are um, are global. I mean, but or at least national. Panda Express is one of them that does a national fundraiser. and the other one is Little Caesars pizza. But Little Caesars pizza is like it's like a kit they send you to your door. And so it's people wouldn't they have to put the pizza together, and so it's most people want something that's already put together for you and ready to go. But that's how they do theirs. Um, Pet Express is really good. Yeah, it's national. Yeah.
So my advice would be, if you're going to do a 501c3, get a lawyer and get an actual accountant to help you, like with the taxes and the bookkeeping. It's expensive, but you can't mess up on these two areas. What did you try to do as a nonprofit?
So I just had to scrap it. But there's also Global Genes and Every Life Foundation who do the same kind of thing, but not exactly. But so yeah, does Paxton have any special dietary needs or feeding challenges that are part of his care plan?
Because that is proven to be very effective with treating epilepsy. But it's very hard when you have a child who's already a restricted eater. So we had to abandon that one a long time ago. One of the challenges he has with eating is that poor motor planning and control. He can't feed himself. When he used to be able to kind of sit at a table, when he had a little more stability and postural control, and there wasn't a risk of seizures with him going, face first into a table, um, we could put him at a table and he could take a spoon, but it'd be hard. It'd be like missing his mouth. So we have to help meat. We have to feed him. He can finger feed a little bit, but even that's getting harder from now. Again, we don't know if that's medication side effects because he's on such heavy doses, or if it's neurodegeneration. So that is a big challenge. And also, he seems to be doing better now, but he was having some problems, or there was some concerns with his ability to like swallow properly. So neurology is actually ordering a swallow study, but that seems to have improved over the past couple weeks. So those were his challenges, and it takes him a while to eat, especially when we have to kind of go slow to make sure he's taking smaller bites and smaller sips. It could take like 45 minutes to an hour to help him eat, and that's time you have to sit there and physically like feed him. Yeah. Yeah. So it eats into your time as well, because your your special needs parent. Our daughter is autistic. She has low support needs. She's incredibly independent. Um, but we still have to like redirect her and make sure she's not getting into things she shouldn't be getting into. Um, and also with running this organization and trying to fundraise, it's like just that little bit of time. It's like usually instead of like taking half an hour to help me, yeah, take an hour, to help me. And that's just like it's half hour that I'm not able to be trying to get media coverage, or half hour that I'm not trying to make a little like extra money through like some like little side gigs, or half hour that I'm not able to be creating like marketing materials for like flyers to like promote events and distribute around like the community. It all kind of adds up into just eating away your time. Just time and money to do things that we're already light on is what we need the most of.
Of us what it means to advocate fiercely for your child. Your courage and leadership are with Cure CLCN6 are opening doors for not just your family, but for future families affected by this ultra rare condition. For our listeners, please visit Cure CLCN6 at cureclcn6.org to learn more about Paxton's journey and find ways to support their life-saving gene therapy fund. Don't forget to subscribe to this podcast and the Rare Connection and my YouTube channel, Rare Chef, where I also do cooking videos and the live version of this podcast. You can also visit rareconnection.org and explore more rare disease stories and connect with their families, with other families. Join Rare Connection Facebook group and stay engaged with our community, with the community. Somebody mentioned this shirt that I'm wearing. So let me bring that up. So this is a shirt that I have on Bonfire, and Bonfire is the website that I go through for the shirts that I create, and I also have one for the podcast and one for my YouTube channel on there, and so those are all available under my Rare Chef account on there. May not be searchable unless, but I can post a link. If you listen to the audio version, you can text me via the link in the show notes. If you're watching the live version, you can please comment below. And remember, if you or someone you know is struggling with mental health or thoughts of suicide, please reach out for help. You are not alone. You can call the National Suicide Prevention Lifeline at 1-800-273-TALK or 1-800-273-8255, or text 988 or to connect with a trained counselor. Thank you for tuning in. Your support and your connection and your voice make a difference. Thanks.